Good evening, everybody. I am about to be joined by Dr. Venkat from Harley Street Fertility Clinic. We were talking just the other night all about egg freezing, and we're going to continue that conversation now. And we're also going to talk about embryo grading because it's something that I found particularly interesting when I was going through IVF. I wanted to know more about what my embryo grades meant, what that meant for success rates and things like that. So I'd really grateful for Dr. Venkat, who will be appearing any second now, to give us her thoughts on that and what that means. And also, if you have any more questions from the other night regarding egg freezing, then please send them our way as we discuss it. We talked about who can benefit from egg freezing, when people should really try and do egg freezing, what the process involves, the cost, and more. So I'm just waiting for Dr. Venkat to join now. She shouldn't be long. And the other thing just to say, in case you don't know, is that we are running a competition with Harley Street Fertility Clinic. They're giving away one of their initial consultations, fertility MOTs, and follow-up consultations worth £250. So if you just go to the Fertility Help Hub website, the link is in the bio, then you can apply there to win. And the competition is running until the 16th of May. So go for it. It's a great giveaway, and hopefully it will benefit someone. So hello to Dana Concierge, who's just joined. So yes, we're just waiting for Dr. Venkat. Hopefully she'll be here in a minute. We had a few issues with signal and the internet on Monday, so we're just going to recap because I had lots of people sending questions after our live, and egg freezing seemed like a very popular topic, so we'll definitely be discussing it more. Just waiting to see if she's there. Last time she was there, but I couldn't see her. Does anybody have any questions in the meantime before we start? I think on Monday there were various questions around cost, and that's something that she touched on. We talked also about how many rounds it could potentially take to retrieve enough eggs suitable for freezing. Again, for those who've just joined, we talked about the reasons why people might consider egg freezing and what's the best time to do egg freezing in terms of in your 20s, 30s, and just to give more awareness around it. So Dr. Venkat's here now, so I'm going to add her in. It'll be good. Bear with us. She's just joining now. Good evening to everyone who's joining. Hello. And please just jump in with any questions as we go. Good evening, Dr. Venkat. How are you?
Good evening, Eloise. Nice to be here. I'm sorry I'm embarrassed a little bit last time because my phone died.
Oh, don't worry at all. Well, it's a very important conversation we're having. We had lots of questions after our live, and I can see some questions coming in now. So if we just could please recap. I've just given a summary about what we're going to be discussing, talking about the process of egg freezing, who benefits from it, the costs, and the sort of success rate it may bring. So if you could please summarize where we were on Monday, and then we can take extra questions, and then we're going to talk a bit about embryo grading, and what that means in terms of success.
Okay, it's not a problem. So we sort of started saying when women should start thinking about freezing the eggs, what is the right time? You know, people always keep on hoping that they will meet Mr. Right, and if it doesn't happen, they start panicking, say around the age of 37, 38, and then I was just mentioning that it's rather late. So if you are going to delay starting the family, start freezing the eggs or consider freezing the eggs at an earlier age, something like late 20s and early 30s, because that's the peak of fertility. So that is the time when the egg quality is at the best, and we want to make use of it. So freeze it when you are young. Then later on, you can always use it. If you don't need it and you meet Mr. Right, you have your children, it's not a problem. This is like an insurance policy. That's what we said. And we also said that, you know, when we freeze the eggs, you know, we can keep them frozen for up to 10 years. Now the HFEA have extended it up to 12 years because of the COVID situation, which is helpful for some women. And at the end of 12 years, say for example, Eloise, you asked that question, somebody is 25 now, at the age of 12 years, she will be 37. And if she is still not ready to have a baby at that age, what will happen? There is always a possibility of extending the storage of the eggs when a consultant or fertility doctor is happy to sign to say that if she doesn't, then she will sort of become prematurely infertile. So it can be extended for another 10 years. That is not a problem. And we also talked about the cost of egg freezing. The egg freezing is not very cheap. I am aware of it. I accept it. But that is because all these things cost a lot of money. And that's the reason. Usually the egg freezing alone, the treatment cost is something like 3,000 pounds. And plus the medication, hormone injections and other things, it will come to 3,000 to 5,000 pounds. And every month, the woman has to pay for the storage of the egg, which will be 25 pounds per month. And at the young age of 25 and 30, I don't think women will have this kind of money. I appreciate it. So in Harley Street Fertility Clinic, we have a finance plan whereby women can pay certain percentage upfront and pay the rest in installments. Okay. And they will have an interest-free loan. There is no interest for this loan, and it will be helpful for such women. And that's what we touched upon.
And that's really useful for people who are perhaps in their late 20s or early 30s and aren't as financially sound as someone who might be approaching 40, for example. When, as you said, that is not the best time to be doing egg freezing. So if you could just sort of summarize a little bit more around the optimum time, that would be great, because that was a question we got asked a lot on Monday. And I guess there's a whole piece, isn't there, around awareness about that, because some people may leave it a little bit late, not realizing the importance of age.
So in this country, UK, we say women should have their cervical smears from the age of 25. Okay, so I always say then, yes, that is the age that every woman should have a fertility checkup or fertility MOT. And as you have seen, probably we offer a virtual consultation and remote fertility checkup for the women. The cost of 250 pounds. They don't need to get out of the house. We will send the kit to their house, and they take a fingerprint test and send it to the lab. We'll have the result the next day. And this should be done from the age of in the early 20s. So women can then start planning their family life, because if someone says, look, I am career minded, I want to come up in life before I settle down in family, then she should think about freezing the eggs soon after 25 years. Yes. But if someone says, look, I'm not so much interested in career, I'm happy to settle down and have my babies now, then it's a different story. So women, I know at this age, nobody thinks about family. 20, 25, everybody wants to enjoy life and, meet different people, and they want to travel. So many things are there in life. But at the same time, if you want to have a baby using your own eggs, it's important to think about it. And if you do a test and it is okay at that time, it's not going to be okay for life. Please remember that.
That's really good advice, because it can change quite quickly, can't it?
Absolutely.
I had my AMH checked at 30 when I was having IVF, and I actually did a test and checked it again as I approached 35 next week, and it has dropped considerably.
Yes, and see, AMH remains sort of stable up to certain age, and in each woman it starts dropping down suddenly, and this age is variable from person to person. So I cannot, or any fertility specialist cannot predict, saying that, okay, you are 25, your AMH is okay now, so till you are 35, everything will be fine. I cannot say that. So if you say, I don't want to freeze the eggs now, then I will say, come back in 6 months' time, check your AMH. Or come back when you are 26, check your AMH. Then before it is too late, you are able to do something about it. So please, we must think about our fertility, possibility of freezing the eggs, and when the woman is young, say in her late 20s, because that is the peak of her fertility. And we also said that the technology is now very helpful. Yes. It has changed. We are freezing by a new rapid freezing method that's called vitrification. The success rate by freezing the eggs with this technique gives a success rate of 90% of egg thawing. What it
Wow.
means is when we take out 100 eggs, 90 of them will survive, which is great news. Previously, by old method, when we were freezing eggs, if we take out 100 eggs, only 40 were surviving. Look at the
Wow.
difference. Big,
Gosh.
significant difference. That is because of the advancement in technology. People have perfected this technique. And in our clinic also, we have made babies from frozen donor eggs, and all of them do well. So there is no problem saying, look, we don't know whether frozen eggs will give rise to good babies, healthy babies or not. You have no worries. It can happen. That's again because of the advancement in technology. That's what we discussed last time.
And that's good, I presume, as well, because if the success rate of thawing eggs is higher, then I presume that you will obviously still need a good amount of eggs to start with, but I would presume that might reduce the number of egg retrievals a woman might have to go through to have the success rate that you would hope for.
Absolutely, Eloise, because if someone does it when they are young, then you'll have more eggs, so you don't have to do many rounds to get decent number of eggs, and your quality is likely to be better.
Yes.
So that way, again, you don't need a lot of eggs. If you have reasonable number, you can end up with a healthy baby. So that's why it's advantageous for everybody to do when you're young. And of course, you can sort of make use of this finance plan to support yourself.
Someone's just said that they turned 36 in 2019. They went to freeze their eggs and were told that they had diminished egg reserve, so they want to start their family and have decided to use a sperm donor, and has had 3 failed IVF cycles. I think that she may have said later on, actually, if you're watching, that she wishes that she'd frozen her eggs at 30. So what would be your advice at that point if someone finds themselves wishing that they'd done something earlier? What should they do at that point? Because there are other methods that can be used in terms of donor eggs and things like that. If am I right? If
Yes.
your own egg reserve isn't good enough anymore.
Correct. You're right, because obviously everybody wants children using their own DNA. That is the ideal outcome. And that's why when women want to freeze and they suddenly realize that AMH is low and the ovarian reserve is not good, then it is a problem. And if they try IVF, the success rate is very low as well. And then in that case, the next realistic option would be to consider using donor eggs. If someone has got a young sister, they can use the sister as an egg donor because you will be sharing the genes with your sister. This can happen only if you are very close with your sister and she understands you and you understand, you are supportive of each other. Otherwise, generally, all these fertility clinics are anonymous donors, and we have a huge egg donation program. People can come and use donor eggs. And sometimes women think that, say, someone is 40 and she has run out of eggs. Women think that, oh my God, I am 40. My chances with egg donation is also going to be very low. That is a misconception, because the chance of success with donor eggs is 50 to 60%. Because
It's good, isn't it? Yeah,
yes,
absolutely. And it doesn't have to be anonymous. It can be an open donor if that's what you wish as well, and that's what the rules are. That's what the rules are in the UK.
it can
And
be.
I guess it's personal preference in terms of how you want to build your family and whether you want to tell your children or not, and what you want that situation to look like.
Yeah, you can have a known donor, that is like your sister or friend or somebody who can help you, who is willing to help you. Then that is one way of doing it. That way you will know where the eggs are coming from, what is the child going to be. But some people don't want to have known donation because they are worried that the child will be affected later on, in which case they go for anonymous donation. Only in this condition, we must remember, in the UK, now the law has changed. That means at the age of 18, child can still find out about the donor. However, the person who is having the treatment is the legal mother and her partner is the legal father of the child. but the child can go and find out about the donor. The donor does not have any right or responsibility over the child.
Mm-hmm. Absolutely, yeah.
Mm-hmm.
If anyone has any questions as we're talking, please feel free to send them over, and Dr. Venkat will be happy to answer them. I think that we've covered. Oh, here we are. Sorry, my doctor recommended I take Prognova. Is that right? And it really helped increase the number of follicles. And the doctor recommended it for women under 40 who have low egg reserve. Is that something that would be your recommendation as well?
Yes, now there are few supplements which women can use to increase the number of eggs and improve the quality of the eggs as well. Because when the number goes down, when the AMH is low, there are two issues, Alois. That is, as we know, the egg number is low. And when the egg number is low, these are the last few eggs in the ovaries. Mm-hmm. It's like last few sort of, Easter eggs in the basket. The good ones are gone first. The ovary releases the good eggs first. So the last few eggs, usually they are not so good in the quality. That is why women with low AMH, they have a lot of miscarriages because of this chromosomal abnormality in the eggs. That is the quality. That is the problem. And that's why we say it's better to freeze when they are young and when they have good number of eggs as well as good quality eggs.
Mm-hmm. So if someone comes to you wanting to freeze their eggs or wanting to look into it as an option, would you look at their AMH level rather than their age to decide whether it's worth it or not?
Yes, no, the age is important, but we also look at the AMH level, because I can then tell them, look, if you're supposing someone's AMH is 2 or something, it's very low, they will need a few cycles to get a decent number of eggs. And I always tell them, look, you start the process now, but like we were talking about the supplements, there are some supplements. These are all little bit of controversial things because there are no randomized control trials.
Okay.
And they say that this is called DHEA, and this one, and coenzyme Q10 and melatonin. These things improve the quality of the eggs and egg number also. Because in my experience, I have had a patient, she had 3 attempts with her own eggs, and her AMH was between 3 and 4. She produced some 5 or 6 eggs, and her egg quality was not good, so her embryos were not at all good, and she didn't get pregnant. So I told her, look, it is now time for you to move on to egg donation, because you have already had 3 rounds with your own eggs. Don't spend more money and time, and also emotionally it's not going to be easy for you. She said, no, Dr. Venkat, I will try. I want to have a baby with my own eggs. You tell me some supplements. So she went on these supplements for 6 months. And then when she came, her AMH improved a little bit. Even then I told her you might need 2 to 3 cycles, which she did. And I'm not making this up. This is a true story. You can come and check with my colleagues. She ended up with twins. We put 2 embryos and she ended up with twins. And she changed the whole picture. Look, here is a lady I recommend egg donation. She ended up having twins with her own eggs.
That's very inspiring. I have to say, actually, from a personal point of view, and this definitely isn't necessarily the case for everyone, but my egg quality was better on my second retrieval, even though I was 2 years older after I'd had my first daughter through IVF. And then we had twins. And I put that down, some of that I put down to my nutrition, the supplements, my de-stressing methods,
yes.
The way I was living. I had longer to prepare for the sibling IVF round. So I feel that my body was in a better state for that cycle. So someone just asked actually about CoQ10. What's your recommendation in terms of that supplement? How much to take? And I presume even if there aren't any randomized studies to say it works, there is no detrimental effect to take it.
Correct. It's
depending on the amount, obviously.
Correct. The coenzyme Q10 is actually a cellular catalyst. How it works is it makes the makes the cell work better or more efficiently. And there are some structures within the cell cytoplasm. These are called mitochondria. Mitochondria are the powerhouse. If they are strong, you will be energetic. So this coenzyme supplies energy or makes the mitochondria perform better. So makes the cell more efficient. And that is why people, even generally, people who want to look better, they take coenzyme Q10. And if they want to study and remember things, they take coenzyme Q10. And in a similar way, this one helps the quality of the eggs, helps with the quality. That's why, like you said, de-stressing corrects the hormone imbalance, Lois, and that way it improves the quality of the eggs. All these things made supplements work in such a way that our body is sort of, the environment for the eggs is much better, so the ovary is able to produce better quality eggs.
Okay, that's really good to hear. And then moving on to our next sort of topic, but I'm just going to say at this point, if in case you haven't seen and you've joined tonight, Harley Street Fertility Clinic are generously giving one of our Fertility Help Hub readers a free consult, initial consult, a free AMH test, and a follow-up consult. So if that's of interest and you're at that stage, then you just need to go to the Fertility Help Hub website to enter, and this will be running until the 16th of May. So very generous offer there, and it's in line with what we've obviously been discussing tonight. So sorry, she was just going back to asking about the dose of CoQ10. I presume it depends on what the way that you're taking it, whether it's capsules or liquid or things like that.
Well, if it is for general purpose, no specific purpose, 30 milligrams twice a day is enough. Okay. Whereas for fertility, if you want to improve the quality, egg quality specifically, the standard dose for that is 100 milligrams 3 times daily, a total of 300 milligrams, which is split into 3 doses.
Great. That's brilliant to hear. So thank you. I hope that's answered your question, Kelly. So let's talk a little bit about embryo grading. And that's something of huge interest to me because I never really understood it when I was told the grades of my embryos. And I feel like going into a transfer, if you're told that you've got an excellent embryo, you're almost set up to assume that it's going to work. Yes. So it's very difficult to take a failure when you've had 2 embryos transferred, which were supposedly top rate quality. So if you could just explain a little bit more about how they're graded and what that means, that would be great. And if anyone has any questions, please ask.
Yes, and you had babies. That means they must have been good, excellent embryos.
Well, I think I can't remember the grading, but they definitely weren't, they weren't top notch. So I don't know.
Okay, so the grading of the embryos is different for day 3 embryos. So as you know, when on the day of the egg collection, the egg is sort of fertilized with the sperm, and that's by IVF or ICSI. Next day we look at it, that is day 1, and we'll see how many have fertilized. At that stage they are 1 cell, and then after that, next day they divide, they become between 2 to 4 cell, and then on the 3rd day they become between 6 to 8 cell. So usually we transfer the embryos either on day 3 or day 5. Nowadays, all the clinics are inclining towards day 5 transfer, that is the blastocyst, because that has a higher chance of success. What I mean is higher chances of implantation. Because normally the embryos come to the uterus in the blastocyst stage, and that is the stage when they attach. Even if we transfer the embryos on day 3, they are just floating around in the womb, and then they become blastocysts, only then they attach or implant. Therefore, nowadays we are transferring the embryos on day 5. On day 3, if we transfer the embryos, I don't know whether you had on day 3 or day 5. So day 3, we call them cell stage, that is 6 cell or 7 cell or 8 cell. So you'll have a number first, and then the grading will be 1, 2, 3, or 4. That is another number, and that will be out of 4 grading. Okay, so 4 out of 4 will be the best grade embryo. It has got the maximum score. 3 out of 4 is a good embryo. 2 out of 4 scoring is average. 1 out of 4 is poor. So usually we transfer only stage 3 and 4 embryos, not 1 and 2, because their quality is not good. What they mean by this 1, 2, 3, 4, is the symmetry of the cells in the embryo. That means one may be big, one may be small. That is, we don't like that. We like all the cells to be of similar shape and regular in outline. And also when they divide, they send out some fragments, like, the metabolic division send some waste material outside into the cytoplasm. These are called fragments. If there is more fragmentation, the grading of the embryo goes down. Mm-hmm. It is not a good sign because it interferes with the implantation. So if yours is the top-notch embryo, it will be, say, for example, 8 cell and no fragmentation at all. That means it's 4 out of 4. That is the best embryo. Okay, and 3 out of 4 also is good. We can have a baby. Okay. If you go to day 5, which is the blastocyst stage, what happens in this stage is day 3 embryo, as I told you, the embryo had between 6 to 8 cells only. Between the 3rd day and the 5th day, the embryo divides much more. And on the 5th day, the embryo has more than 100 cells. Mm-hmm. And also it develops what is called collection of fluid inside. That is why it is called blastocyst. Because cyst means fluid collection. Blastocyst, blastomeres are the embryo cells. So there is a collection of fluid within the embryo cells. That's why it's called blastocyst stage. Okay. Now, at this stage, what happens is the embryo is more advanced and more differentiated. If you look at the cells on day 3, all the cells are the same. Whereas on day 5, the cells differentiate into 2 groups of cells. Mm-hmm. So at one corner, say for example, imagine a ball. It is because in 3 dimensions, and in one corner on one margin, there will be a clump of cells. These are called inner cell mass. That is the technical term. But in other words, these cells become the baby or the fetus. Mm-hmm. And there will be another set of cells which are sort of along the margin of all the, the circular thing, round thing. And those cells become the placenta.
Okay. So, thank you. And someone's just asked, have you ever known success with the day 7 embryo?
No, in this country, we don't transfer day 7. Maximum is day 6 we transfer.
Okay.
Day 7, we are not allowed to transfer.
Okay, so
we freeze.
Freeze, okay. So someone said that they have 2 embryos left. They're transferring them in June. Embryo 1 developed day 6, grade 4 CB, and the second embryo day 7, grade 4 BC. What are her chances? She's rather nervous.
Yes, it is. But all this, okay, the grading I will explain little more. In the embryo, the blastocyst stage grading is done in a different way. Mm-hmm. Initially, it is a small ball, and then it expands like this, gets bigger and bigger and bigger. So as the expansion gets bigger, the scoring is much better. So small one is called 1 blastocyst. Then it is 2, 3, 4. 4 is an expanded blastocyst. 5 is further expanded. Then there will be 2 letters followed by this number in blastocyst. First letter refers to the grading of the inner cell mass. That is the group of cells which will become the baby or the fetus. So if someone is 4AA, for example, that first A is for the baby cells, and the second A refers to the placental cells.
Okay.
So if this lady has B, did you say 4BC?
Yes.
So 4BC means it's fully expanded blastocyst, which is good. B means A and B are good grading of the cells, so that is good. C is slightly lower than B, but remember, it is the placental cell grading. More important is the baby, that is fetal cell grading. That's why the first letter is more important than the second letter.
Okay, and you shouldn't generally be disheartened if that's a B rather than an A, because obviously everyone assumes that A is top notch and going to result in a better outcome.
Yes, no. Look, you never know which embryo is going to give you a baby. We once transferred, you won't believe, once transferred 4 BB to one lady, and she had another embryo, which was 3DD. D for David, okay? D is the worst of all, A, B,
Right.
C, D. And so we told her, look, have your good embryo, don't worry about the other one. And she said, look, it is a potential baby for me. I don't want to throw it, so let me also have that anyway. It's going to be, otherwise we are not going to freeze it because the quality was not good. So we were going to discard it. So she said, look, I don't want to discard it. Let me have that one also. You won't believe, we never thought it would happen. She ended up with twins. One was from BB, other one was, so when she had 2 girls. One girl was running around, the other one was very quiet and sitting. So she always says the one which is running is BB, other quiet one is the DD doctor. What
So
I want to say is, like, don't think that BC and CC will not make babies. We never know which embryo. Every embryo is a potential baby. Of course, we want everything to be perfect. We want everything to be AA, but it doesn't happen. Go with a positive thing, prepare well, and if it's meant to happen, it will happen.
And I guess that's a good point to say, isn't it? That people need to, have these conversations with their fertility clinic to ascertain what, take their advice in terms of what the embryologist is saying, what the specialist is saying, and trust that they'll be making the judgment about which one to transfer, if there is one or a couple to transfer.
Correct. And if they are not of good quality, I don't think the fertility clinic would have frozen those embryos.
Okay.
So there is a reasonable chance of that embryo giving rise to a baby. That's why they have frozen it. It's not the top notch, but still, hey, let's try. If it gives you a baby, we are all happy at the end. So don't think, oh, my chances are low. No. Every embryo has a potential. You have to make it better for the embryo to develop inside, do everything, develop your lining, and do other tests with support mechanisms and everything. And we have to think about it like that. Yes, whatever we have got to go for the embryos we have got. And we should not feel dejected about it.
Sorry, someone has just asked or said that they had 2 frozen embryo transfers with 5AA embryo in the first and 4AA during the second. Both her cycles failed. She had a chemical pregnancy from the second one. Does multiple embryo transfer increase success rate? It's a good question.
Well, it depends on the age of the woman, because if a 5AA embryo from a 32-year-old woman is different from 5AA embryo from a 42-year-old.
Right.
The chemical contents are very different. Why I say that is the implantation potential of the embryo, which was from a 32-year-old woman, is higher. And not only that, the phrase which says appearances are deceptive is applicable even to the embryos. Because even if it is a top-notch embryo, 4AA, is it chromosomally normal or not? Nobody knows. So nowadays, we are recommending more and more of testing the embryos. So if somebody has 4AA and 4BB, we will say 4AA is the best one, we must transfer it. But you check these 2 embryos, 4AA might have Down syndrome chromosomes, extra chromosome, so it's an abnormal embryo, whereas 4BB might have all normal chromosomes, in which case, if you transfer 4BB, even though it's not so good as the first one, it's likely to give a healthy baby at the end.
Right.
Whereas if you transfer 5AA, that has abnormal chromosome, I'm only saying that, I'm not saying all the 5AAs are like that. I'm saying unless we test, we don't know. So even though it was a great quality embryo, probably these miscarriages and failure the failure of the treatment happens because of this chromosomal issues. That is why nowadays we say, especially when we are going to transfer one embryo, we want our patients to get pregnant in the first attempt. That means if I have 3 embryos, which one will I choose? So I have to put the right embryo inside. What is the right embryo? one which has got good implanting capacity, which is shown by the grading, and also which has got normal chromosomes. These are called euploid embryos. That means the pregnancy is likely to continue. She's not likely to miscarry because of all these issues. And at the end, we'll have a healthy baby, not some disabled baby or other issues. So,
and someone has asked, is the grading subjective to the embryologist?
yes, it is done by the embryologist as well as with the clinician, because now we don't need to take the embryos out. They are in the time-lapse embryoscope. You go into the lab, you can see with the camera how the embryo has, behaved throughout the night. In the morning, you look at it, then we can say, but usually done by the embryologist. That's why the experience of the embryologist is very important.
Of course. Does an expansion grade of 2 on day 5 mean it has less chance of success as it is less expanded?
Yes, expansion, say comparing two embryos where one is more expanded, other one is not so expanded, then the expanded one, which is 4 in grading than 2, has a better chance of implantation.
Okay. Great. Well, thank you so much for answering those questions and for all of your expertise this evening on egg freezing and also on embryo grading. If anyone has any more questions, please feel free to send them over and I can pass them on. And also, thank you everyone for joining. And as I mentioned, if you'd like to take part in our giveaway, then please go to the Fertility Help Hub website. The link is in the bio, and you can enter there for a chance to win a fantastic giveaway.
Thank you, Alice.
Thank you very much. Have a lovely evening, everyone. Thank you for your time. Bye-bye.
Bye.
Bye.